The healthcare system was made to benefit everyone. It was made to provide support and heal injuries, diseases, and more. Its sole purpose is for the good of the people, but a lot of the time, factors come into play that make it into the opposite. There are many discrepancies that exist within today's healthcare system that prevent citizens from getting the help and care that they deserve. I am here to highlight the Black female experience in healthcare, and hopefully shed some light on concerning statistics and problems that prevent Black women from receiving the quality and quantity of treatment that they deserve. Before we even touch the healthcare system, it is important to note that there are many factors that may prevent Black women from accessing healthcare. One of these factors is social determinants. The health and life of Black women in this country is deeply affected by social determinants such as availability of resources, socioeconomic status, transportation, quality of life, and neighborhood composition. Many African American families in the United States don't have access to health insurance because they fall under the federal poverty line. This is not to say all Black people are poor, because that is simply untrue. It is to highlight the effects of generational poverty faced by many Black families due to centuries of systemic racism and practices made to benefit the white man while bringing down Black families. The practice of redlining was essentially when people of color were denied mortgages in wealthier urban areas so that they could not afford the homes in the rich neighborhoods or even renovate the homes they already lived in. This immoral practice trapped many Black people in poor and deteriorating neighborhoods, in turn contributing to food insecurity, poor health outcomes, lack of green spaces, and concentrated poverty for many African Americans. This, along with racist hiring practices, segregation, the wage gap, and more, contributed to a lack of accumulated wealth from predecessors, lack of opportunities that grant access to economic mobility, Black households not having tax-advantaged forms of saving, persistent labor market discrimination and segregation, and so on and so forth. That being said, many Black women who do turn to the healthcare system do not often receive the care that they deserve. Take Arista Ware II, for example. It took 7 years of suffering for 28-year-old Arista Ware II to get a diagnosis. She and her family went to countless physicians and told them they suspected she had systemic lupus erythematosus. Her medical tests indicated that she had an autoimmune disease, and her blood work clearly indicated that there was something wrong with her body. All of these facts were evident from the beginning, so why did it take a full 7 years for doctors to finally listen to Arista and properly diagnose her? To explain the reason in simple terms, Arista Ware II is a Black woman, and the physicians that were meant to help her turned her away and put her life in danger solely because of ignorance and racial biases. This case, unfortunately, is not unique. Many Black women have come to the healthcare system in hopes of being treated and listened to, but were denied medicine or turned away simply because their healthcare provider did not believe them or let their racial biases speak louder than the testimony of their patient. A prime example of this would be the story of Dr. Shalon Irving. In January 2017, just 3 weeks after giving birth, Dr. Irving died of complications related to high blood pressure. She was an epidemiologist at the Center for Disease Control and Prevention and a lieutenant commander in the U.S. Public Health Service who dedicated her career to investigating public health disparities. Pregnancy had been a challenge for Shalon, who suffered from a blood disorder that caused clotting and discomfort. However, she remained vigilant in monitoring her health throughout her pregnancy and delivered her daughter, Soleil, via cesarean section at 37 weeks. Though the delivery had been a success, healing from the operation proved to be a slow process, among other things. Her blood pressure fluctuated in the weeks after she gave birth. Certain that something was not right, Shalon continued to follow up with her doctors, though her health continued to deteriorate. On January 28, 2017, hours after returning from an appointment with her doctor, Dr. Shalon Irving collapsed at home and died at the age of 36, leaving behind her infant daughter. African American women die of pregnancy-related causes at 3 times the rate for white women, even after accounting for income, education, and access to other resources. In addition, statistics collected in 2016 show that the U.S. infant mortality rate for African American women was 11.4% compared to 4.9% for white women. According to the Journal for Women's Health, Black women currently make up 7% of the U.S. population and 13.6% of all U.S. women. Although on average Black women are younger than U.S. women overall, they have a higher prevalence for many health conditions, including heart disease, stroke, cancers, diabetes, maternal morbidities, obesity, and stress. Life expectancy at birth is 3 years longer for non-Hispanic white females than for non-Hispanic black females. Infant mortality rates for children born to non-black Hispanic women are twice as high as those for children born to non-Hispanic white women. I am only one person, and I cannot magically make this country fair and just, but what I can do is bring light to a crisis in this country that affects not only black women but the entire country, because this is not just a black woman's issue, it is the country's issue. I have started an Instagram page called BWRD Health. It sheds lights on these issues I talked about in this video and provides access to articles detailing this issue and organizations working to lessen it. This video may not solve this issue, but it can serve to spread awareness. I hope you take the time to look at the Instagram page and hopefully read more into this topic. Thank you for listening.